So today we're going to be talking about bone health and about osteoporosis prevention in particular. And we really want you guys to get a lot of good information from this. We want to make sure you have a good understanding of the basics of what it takes to have healthy bone tissue, and then also the basics of how you can start really working to prevent any further loss that might have already happened. So I want to just start by introducing our care team here. So here at Prosper, we have what we call a care team, which means that we work with all of our patients in concert. So all three physicians kind of put their brains together and work through cases, which has just been such a delight for me. I'm Dr. Molly Force. We have Dr. Rosalie here and Dr. Mary as well. And what we love about this approach is that each of us come with a little bit of a different background in regards to our education. Although we're all three naturopathic physicians, we have some specialties that we bring in, and it allows us to really get a very holistic approach for our patients, which we adore. So one of the great things about being a naturopathic doctor for me is that I kind of get to really think outside the box a little bit and take the time to get to understand the physiology behind what could be going wrong in people's bodies. So one of the really important reasons that we want to make sure that we are talking about what bone is in the first place is we want you guys to understand that this is a living tissue for us. These cells are constantly turning over and remodeling. And that actually gives us a lot of benefit here because it means it's not static. So if we have that bone loss, it doesn't necessarily mean that it's permanent because we have these cells that are building. So the osteoblasts do the bone building and the osteoclasts do this bone breakdown. And this is a continual process, a continual dance and remodeling that's happening. And generally we think about it happening over this 2 to 3 month cycle. And that's really important to us as physicians because when our patients ask us, when should I get retested? Those kind of things. We want to know how long it takes for the bone to make a transition once we start our therapies. So in regards to our bone health, as we age, we go through this peak that happens around 25 years old. And we can see the differentiation here between the biologic male and the biologic female for our bone mass. And as we go through our aging process, our bones begin to diminish as far as their density, their mass. And so, of course, many of you know this. And what the general calculation here is that if you're over 50 years old, it's estimated that half of a percent of bone loss is lost each year on average. Now, for women, we can really see this begin to dip. And this has to do with hormones. And we're going to get into the nitty gritty of that here in just a few minutes. But you can see this differentiation made by the hormonal input that happens after 50 years old for most women in particular. And so we're going to talk about how that impacts us, especially as women, how that impacts our risk of bone mass loss as we age. So when we're thinking about our bone, it's important to realize that it does look almost like this spongy tissue. So you can see here on the left, this is our normal bone tissue. And as we go through our aging process, and as we go through other factors that can cause quicker degeneration of our bone, we get more of this porous looking material. So you can see osteopenia is the medical term here for a loss of bone density that's not as severe as osteoporosis. And so we have a calculation as physicians that help us know whether our patients are in that more beginning stage, that osteopenia stage, or in the actual diagnostic osteoporosis stage. And we can see over here on this right-hand side, this more severe bone breakdown and bone degeneration that can happen. Now, bone loss is a silent disease. And of course, it's a huge deal because as we age, one of our biggest risk factors of fatality is hip fracture. So is a bone fracture. And that's because as we age, it can get harder and harder to repair those bones. So as the bones become more porous and more weak, they of course become more prone to fracture. And we have some patients who don't find this out until they accidentally stumble and trip and fall and have an unexpected break. As far as testing, this is really important to us. And especially as natural physicians, we really like to know how our patients are doing so we can really employ these methods of supporting them if we need to in regards to helping our women who are over 65 in particular, making sure that they're getting the screening exams that they're needing. So at that point, we really like to start to see imaging, and that imaging is typically called a Dexa scan, DXA or DEXA. Sometimes it's also written out. And what that is it's a type of X-ray technology, and it helps us really understand if how dense this bone tissue is, and it allows us to give a number to it and really do some good calculations so we can compare to the prior years. Now, there's other forms of testing too that can be done. We sometimes will use urine tests. We can look at some of the metabolites of the bone breakdown products and minerals that can come out in urine. That can be a little bit trickier, and it can really be affected by the foods that we're eating sometimes, but it is a nice check-in for some patients, especially if they're making major changes to their strategy and want to make sure that they're getting that improvement. There are also little pieces that we can pick up on our blood work, even your standard annual panel, which if you haven't gotten done in the last 2 years because of the pandemic, we highly recommend this is the time. Make sure you go in and get your annual exams done. There's so much that can be picked up, and we have so many patients who've just missed these milestones this year, these basic check-ins this year because of the pandemic and the limitations to getting in for in-person care. But that being said, on your annual panel, there's a specific marker that I'm usually checking for and that we usually want to look for here at Prosper called alkaline phosphatase. Now, this tells us about bone turnover. So if we all of a sudden see your alk phos marker on your annual blood work jump from year to year, then it is a major red flag for us. And we want to make sure that we are doing everything that we can to really help get something changed for our patient, figure out what it is that's really causing this bone breakdown. So looking and making sure that there's nothing really causing that as far as medications and things like that, and then making sure we have strategies implemented. As far as bone samples, that happens in more severe cases. They definitely use it in the medical literature when they're doing certain studies. And that's hopefully something that most of you will never have to experience, but that is another way to look at the bone density itself. Now, when we're looking at bone density and we're looking at DEXAs, this is our most common form of testing. It's something that's covered by many insurances. And we use a scoring system called a T-score. Now, with that T-score, we have the scale that's set up. So 0 is considered a normal bone density. And that level goes down to negative 1.0. So if you score between a 0 and a negative 1, you're considered normal for your age, demographic, and biological sex. Now, if your number slips down lower between a negative 1 and a negative 2.5, then we've reached that osteopenia. Now, remember, this is that beginning of the bone loss stage where it's actually getting to be a medical diagnosis here of bone loss. And if we go beyond that negative 2.5, we're in the osteoporotic zone. Now, that's a big deal because that puts us at significantly higher risk of fracture and of that bone weakness and that bone fragility that we don't want to see. So the big concern, of course, are these bones that are going to be at risk if we do have an impact injury. So that's like a fall. So our wrists, where we're extending out that impact, our spine and our hips being some of the greatest areas. And these are often regions that are looked at on our visual testing with that X-ray form of testing of the Dexa. So many of the Dexa lab or Dexa screens will do specifically hips and spine, and some extend onto wrist and even ankle. So you can see here that as we go on, our risk of increasing fracture over a 5-year span increases dramatically as our T-score gets lower and lower, gets further down on that negative scale past that 2.5. So there are grades of bone degeneration is the takeaway here. And our general form of discussing this as physicians is talking about bone density loss called osteopenia, or the more severe form called osteoporosis. And we want to make sure that we are preventing changes or continuation of that. So I believe Dr. Mary is going to take over from this slide.
All right, hello. So next I'm going to talk about risk factors for osteoporosis and what we can look out for in terms of preventing bone loss over time. So the first risk factor is increasing age. So we see osteoporosis increase in the elderly, and this is largely due to declining estrogen over the course of our lifetime. It's much more common in females. So females are 4 times more likely to develop osteoporosis. And estrogen plays a huge role in terms of mediating this disease process. So estrogen blocks bone reabsorption. So it helps maintain bone and allows it to stay in place. So low exposure to estrogen can be problematic over time. This can happen with late menses or early menopause. And it can also happen with estrogen blocking medications that can often occur, that patients often are taking after, for instance, a breast cancer diagnosis. And one of the other risk factors is not using hormone replacement therapy after menopause. And this is particularly true when someone goes through early menopause. So when someone goes through menopause around the age of 40 and doesn't use any hormones between the ages of 40 and 50, that's going to set you up for decreased bone density over time. We also see an increased risk of osteoporosis in folks with really thin bodies and thin frames. And this is because of multiple factors. We actually produce a lot of estrogen in fat cells. And so when you have really low fat content on your body, you're not producing this form of estrogen that we call estrone that does help maintain bone density. And then when you don't have a lot of weight weighing down on your bones, that's less stress on your bones over time. And we need that physical stress to encourage our bones to build density throughout our lifetime. We also see an increased risk of osteoporosis with hyperthyroidism and smoking. With alcoholism, you can have decreased calcium absorption. So this is the biggest risk factor for men. And we also see with depression an increased risk of osteoporosis. And this is mediated by noradrenaline that harms bone building cells. So next we're going to talk about certain medications that can leach nutrients, either prevent calcium absorption or increase bone reabsorption. So here we've got corticosteroids. So often with our autoimmune patients, we'll see long-term use of corticosteroids can cause decreased bone density. This can happen with medications like prednisone. And this can happen with breast cancer therapies because we want to block that estrogen action. And this can lead to, so we just need to be aware of promoting bone density in those cases. Diuretics can increase the excretion of calcium through the kidneys. And then we see with blood thinners, the long-term use of Coumadin often means that we're getting decreased vitamin K, which is a requirement when you're taking that particular medication. And as you'll see later, vitamin K is another really important nutrient when it comes to building bone. We also see bone loss with anti-seizure medications, thyroid medications if you're taking too much thyroid, because thyroid causes increased bone reabsorption. And we also can see this with some cholesterol medications. Okay, so signs that when your body is starting to communicate that you've got some decreased bone mass, you can see this with loss of height. So if you go in for your annual exam and you're suddenly an inch shorter than you were before, that's a sign that your vertebrae may be losing some bone density and it's time to get a Dexa. You also see this with stooped posture to the right. It shows what can happen with a vertebral collapse. And that can cause us to kind of hunch forward. Back pain can also happen with that vertebral collapse. You can have radiation down your legs and sometimes pain right on your spine. And then, as I was just mentioning, with the vertebral fracture, you can have all of these signs, and then you may have a fracture in another bone, and most commonly it'll be in the femur, so upper leg, or in the pelvis. All right, so conventional approach. So for these medications, there's definitely a time and a place to use them. Bisphosphonates are the most commonly used osteoporosis medications that stop osteoclast activity. And they do have some significant adverse side effects. So, we'll see esophagitis, esophageal ulcers, headaches, abdominal pain, acid reflux, nausea, weakened bone matrix. So these are all just things to be aware of and consider when you're considering how to move forward if you have a diagnosis of osteoporosis. And then of course, in the conventional medical world, using calcium and vitamin D as supplementary nutrients is a common therapy. All right, so next, Dr. Rosalie is going to talk us through our goals with our patients and some alternative approaches that we use at Prosper.
Thanks, Dr. Mary. So as naturopathic physicians, this is where the medicine becomes really exciting. It's because we can sort of take this problem at hand, which is osteoporosis, and sort of break it up and have different goals with our patients, instead of going straight to a pharmaceutical approach. So first of all, we've got to find physiologic balance. So that involves all of the body organs. And we've got to provide protective benefits for the bones specifically. And there's 5 goals we'll walk you through of how to do that from a naturopathic perspective. So those 5 goals include, how do we, increase load-bearing exercise in our lives? How do we diminish inflammation? How do we get adequate minerals and a balanced diet that allows for absorbability of those minerals? And as well, how do we get the appropriate amount of microflora and the biodiversity that we're looking for in our GI tract? And lastly, hormone balance is very important, especially for those that have undergone menopause. And we could do all of this while managing the symptoms of osteoporosis, which might include bone pain or stooped posture, to increase quality of life. So first goal here is one of the most important. Well, they're all important, but this one's a big one where we start with, and it's weight-bearing movement specifically. So osteoblasts, remember, those are the ones that build bone. They require mechanical stimulation. So from walking around to doing weights to backpacking, all of these things will have an effect, will vibrate the bones, and the osteoblast will respond in response to this vibration and build bone, okay? So that's first and foremost. We're in a society where many of us have desk jobs where we're stagnant, and that also contributes to poor posture. If we've got poor posture, the bones are being stacked in the wrong way, and we're sort of promoting a stooped posture. If we've got 50 years of that experience of that poor posture, we end up stooped at the end of that time. So how do we increase weight-bearing movement? First of all, walking. That's kind of our baseline. We need to be generally moving every day. What you can do to add weight-bearing and a weight-bearing approach to your walking is to maybe bring some small weights with you, or wear a weighted vest, or maybe you take a heavy backpack, or you go on a hike. These are all going to help add in that level of weight-bearing exercise. Pilates is also great. There's a lot of studies showing that Pilates and yoga long-term especially are helpful for preventing hip bone loss. And then there's that weights bullet point again, where we've got to do some weight training, weight strengthening, in addition to balance exercises to prevent us from feeling off balance, so that we prevent falls, because if we fall with an osteoporotic bone, that's generally is going to lead us to a fracture. So here's our first big takeaway. Get walking, get moving, add some sort of weight to your walks. And maybe it's just a fanny pack that holds your water bottle, but sort of getting that weight-bearing movement in on the daily prevents us from being stagnant, helps our bones to build.
So one of my very favorite recommendations, and one that we use quite a bit here at Prosper, is the recommendation for a vibratory platform. And I want you guys to just take a quick second where you're sitting or standing right now, or maybe you're even out walking. And I want you just to check in on your posture, because this is a really great little exercise that can help you, if you can remember it, it'll help you on the day to day, and that will play out over the years in regards to your bone density. Because when we utilize that gravitational load, we are giving information to those osteoblasts so that they can build. So check in real quick with your posture. Think, are your ears aligned over your shoulders? Are your shoulders stacked over your hips? Are your hips stacked over your ankles? So check in with those large, points on your body, and think about that alignment. Because even just having your chin in what we call this anterior tilt, jutting forward, even a fourth of an inch will make an impact on the weight that the gravity is pulling those bones. So one way we can take this even further is to add in vibrational, or even better, oscillatory force. So you guys may have seen these in Costco, for example, or seen an ad online for these kind of things. But essentially what they're doing is when we add an oscillation or a vibration, it requires, we get a signal from our cerebellum in our brain that says, hold still, stay upright. And that sends a signal down to our muscles, which then engage the tendons. And it's the tendons themselves that attach to these bone cells, these bone tissues. And that pulls on the osteoblasts, providing them with that mechanical input that they need. So these vibratory platforms are pretty phenomenal in my experience with working with bone loss with patients. And now, having used them for around 7 or 8 years, it's been phenomenal to watch people's numbers, their Dexas, with frequent use of these vibratory platforms. And what I mean by that is somewhere between 10 and 30 minutes of use a day with this kind of extra vibration. And what's phenomenal to me about these little machines are you can really target in the areas that are experiencing the bone density. One of the beautiful things about getting the bone density testing is we then have the information. Is it your spine or your hips that are at most risk? And we can really target therapies in regards to the weight-bearing exercise once we have that. So you can see with these platforms, they come in all kinds of different shapes and sizes. The difference between the vibration is it goes in this XY axis back and forth, and oscillation goes in an XYZ axis, which actually provides us with more questioning for our cerebellum, which provides us with more information going to those tendons to pull, and we get more directional force put on those different tendons, which then will help us with increasing the bone density. So those oscillatory platforms, once again, can be used for upper body. You can see this example of the wrist here in the plank position. They can be sat on for the hips and the spine, stood on for the lower legs, all kinds of really cool stuff. So if you haven't heard about these, they're a really neat tool, and they do come from very inexpensive to very expensive, but do your research a little bit. Think about looking for that actual oscillatory movement if you can, and adding that into your regimen. It's a pretty phenomenal tool here as far as the weight bearing and mechanical piece of bone density. Now, our number 2 goal is one that can be often overlooked, and some people don't even realize, but inflammation in the body has been shown time and time again in the literature to affect bone density. So if you feel like you've got this hidden inflammation going on, it's really important that that root cause is looked at. And this affects our bone density long-term. So do that research that it requires to figure out what that source of inflammation is, and do your best to remove it. And that's something that we do with our patients quite a bit, is doing the labs and the studies to try to figure out what their cause of inflammation can be. Now, when we have inflammation, it affects so many different things. It can affect the digestion as far as how the minerals are put in, but it can also affect these cellular pathways and the cellular building pathways that the osteoblasts undergo. We know that the literature also suggests that anti-inflammatory oils can help bone density. So here's where we see things like good quality fish oil, not the rancid fish oil, but I'm talking about the good stuff that doesn't taste like it's already oxidized, that doesn't taste extra fishy. That kind of fish oil can be very helpful for managing inflammation and can be helpful for bone density as well. So if it's not something that you've put in your toolbox of tricks here for bone density, please add that one. Now, I love this little page because even though it's very simplistic with the arrows, it kind of shows us the chemical breakdown of how we create these different forms of essential fatty acids in the body, and how the end game of that, or the end gain of that, I should say, is these helpful prostaglandins. And prostaglandins are our anti-inflammatory chemicals in our body here, or these ones are. So we're talking about everything from evening primrose oil and borage oil, and these cofactors that go on with these are these B vitamins, and you can see vitamin C and zinc and magnesium for that linoleic acid pathway. And then the alpha linoleic acid pathway requires other cofactors as well. And then we can either get them by taking flax or pumpkin seeds, or we could get those forms of prostaglandins simply by taking marine lipids, and that's where the fish oil comes in. So the point of that, I should say, is really for our vegetarians and vegans who do not, want to take fish oil. They can use other oils such as the flax or pumpkin seed, and they can, and chia as well. That's another omega-3, or algae to get those oils, but those are also great inflammation. So once again, if you're worried about inflammation as a health concern, it certainly affects our wellness over a long term and absolutely has implications for bone density. So we highly recommend getting tested for that. There's all kinds of blood markers in particular that we like to do to check for that with our patients. So I'm going to hand this over now to you, Mary, to Dr. Mary.
Okay, so now we'll go into diet, a really crucial part of this conversation. So a balanced diet is really important for providing the sort of fertile soil we need to lay our bone over our lifetime. Let's see, next slide, please. So there's many different components of bone, and we often think of calcium as the main one that we focus on. But we also need magnesium, phosphorus, strontium, and boron to build bone. And these are all important, or it's important to pay attention to getting all of these nutrients as part of a healthy, balanced diet so that we can keep building bone when we have the opportunity to. Can go to the next one. So calcium is our major player here. Typically with calcium, we recommend that folks try to get about half of their calcium intake from their diet, and then we supplement about half with about 500 milligrams of calcium daily. Next slide, please. So there's many different kinds of foods that contain calcium. We often, in sort of I think the general conversation is largely focused around dairy, but as you can see here, there's many different forms that we can find it in. So in quinoa, amaranth, leafy greens, dairy, almonds, sardines, canned salmon, and soy. So sardines and canned salmon are an excellent source of calcium. And with those, you want to make sure that you're actually eating sometimes you can see little bones and spine in the cans. And it's important to not take those out because you can chew on them, and they actually are where most of the calcium lies in that food. And with calcium, just remember that vitamin D is essential for absorbing calcium. So getting your vitamin D checked regularly and making sure that you are at an adequate level is just an important thing for your bone health. That's an important thing to pay attention to over time. And in the Pacific Northwest, most folks need some level of vitamin D supplementation. So really crucial to keep that in mind. All right, so as we were talking about, dairy is not the only source of calcium. And in fact, many people have trouble with dairy for a host of reasons, whether it's causing GI inflammation, whether it's causing loose stools or mucus production. So it's just, we like to realize when we're not having dairy in our diet that it's important to get the calcium in other ways, but there are many ways to do that. All right, you can go to the next slide, please. Yeah, and so this is just a reminder that there are many different hormones that we find in our milk. There's added hormones in non-organic milk products that are growth hormones that are given to cows. And then there's a host of hormones that the cows are actually producing in their own bodies, and their hormone levels depend on their own reproductive cycles, and we can often get pretty good amounts of estrogens and androgens through milk sources. So just another thing to think about. I wouldn't say milk is necessarily bad for everyone, but it's something that it's good to drink it in moderation and pay attention to how it makes you feel. All right, and just another reason to focus on eating organic food, specifically with animal products and milk products. All right, now I'm going to pass this off to Dr. Rosalie here.
Thanks, Dr. Mary. So some of the cofactors that actually help with calcium absorption are our minerals, magnesium and boron. And if there's a magnesium deficiency, it's hard for the body to absorb calcium as well as vitamin D. Both are nutrients that we know are necessary for bone growth. So it's worth checking in on whether you're taking a magnesium supplement or whether you're eating foods that contain magnesium, which our big source is our sea vegetables. But also, interestingly enough, all vegetables have magnesium because chlorophyll, the center of the chlorophyll molecule, is a magnesium. Sort of similar to in animals, the center of our hemoglobin is an iron molecule, okay? So anything that's green and leafy has magnesium. How well it's absorbed really depends on the other constituents in that plant and the other nutrients. But all in all, it's worth saying, if you're not eating sea veggies, find a way to sprinkle them onto your foods. Or make a seaweed salad because there's these two really helpful cofactors that help with absorption of both calcium and vitamin D. Boron is specific in extending the half-life of that vitamin D as well as estrogen in the body, which Dr. Mary touched on earlier. So with plants, with eating plant-based foods, we can also run into the problem of phytates. And phytates are present in a couple of foods, and they block mineral absorption, most specifically iron, zinc, magnesium, and calcium, okay? So these are found in grains, in legumes like our lentils, in unsoaked nuts because they're sort of on the outside, as well as in soda. So how many how many of these foods are you eating in a day? And are they potentially contributing to blocking mineral absorption? It's worth checking in on that given your diet. To supplement magnesium and calcium, we like to see them together. Like I said earlier, they're kind of cofactors for helping the absorption and the assimilation. There's a bunch of different types of CalMag products out there. Magnesium citrate, magnesium malate are the ones that are best absorbed. There's other types like magnesium oxide, which work as laxatives because they're not well absorbed. And then it's worth thinking about what form we're getting the calcium magnesium product in. All sorts of different ways to absorb this product, from liquid to powder to capsule. And the general ratio is to get 2 parts calcium for 1 part magnesium. And the typical dose there is 600 to 1200 milligrams of calcium for 300 to 600 of magnesium. Evening is the best time of day to take a CalMag product because the magnesium is a bit sedative. It's better known as an anxiolytic, so it breaks apart anxiety, but it does help essentially with sleep in that way. And whether you take it with or without food depends essentially on whether you've got a history of kidney stones or not. Here's a CalMag product that we recommend here at Prosper. It's a liquid CalMag that's got a nice flavor and it's got that perfect ratio of calcium to magnesium in the most absorbable form. It also contains some of the cofactors that help build bone, including boron, vitamin K1 and K2. And the liquid helps with the most maximal absorption in the GI tract. Here's another product we really love, this magnesium glycinate product that sort of is touching on the same things we discussed prior. Helps with bone health, supports healthy sleep. It supports muscle function because it finds its way into the muscle tissue to prevent cramping. So if you've got nighttime cramping or muscle cramping after exercise, think of magnesium. It's also helpful for that cardiovascular system. And if we're having too much magnesium, like I said, it could have this laxative effect. So typically we dose it to bowel tolerance, which just means it depends on the person. If you're having 200 milligrams and you're having loose stools, that's your bowel tolerance. That's fairly rare, but it does happen. And then lastly, one of these other big cofactors is our vitamin D. Vitamin D and calcium go hand in hand, same as magnesium and calcium. Best way to get it is from the sunshine, but not, we've got to manage our skin cancer risk there as well. 20 minutes max is kind of the maximal absorption that your skin can take in and make vitamin D from it. Cod liver oil is another excellent way to get vitamin D, as well as add in that anti-inflammatory support Dr. Molly was talking about earlier. And then we only typically supplement vitamin D3, okay? Other vitamin levels of other vitamin Ds, like vitamin D2, are not safe to supplement, and it's worth checking blood work annually to make sure we're not over supplementing our vitamin D. That's something I have seen in clinical practice, and it's something we have to check in on because it's not healthy to have high levels of vitamin D. Vitamin K is another, cofactor here. And what's amazing is that vitamin K typically comes from bacteria and our microflora. So having a nice biodiverse microflora helps with absorbing, or essentially helps them make the vitamin K for us to absorb it. It's also found in other foods, our molasses, dark leafy greens again, green tea, oats, alfalfa sprouts. In terms of supplementing, K2 is typically what we're supplementing. It's the best one absorbed in bones. And the nitty gritty of it is there's different MK, this is more biochemical, but the MK7, we might start to hear this in the media outlets, is the one that's best absorbed and found in fermented foods like natto.
So we just heard why K2 and vitamin K in particular is so important to get from our gut flora. So, and remember, there's this relationship between these two fat soluble vitamins, our vitamin D and our vitamin K. So a lot of my patients, it's been really interesting. They may be supplementing with D, and it's not until we do their blood work that we realize that they're not getting enough for some reason. And once we add in that K2, that helps that D3 come in, and then we start to see their D levels go up. And that's so important for those bones to be doing that osteoblastic building activity and correcting any loss that's happened. Now, with our gut, it's not just as simple as this gut flora making this vitamin K2 for us. Because remember, when we looked at those 3 forms of vitamin K, most of it's being manufactured by our gut flora. And we hope that our gut flora is well enough to do that. The gut also, of course, is going to affect our nutrient absorption as a whole. So it's a big deal when our gut is imbalanced. So I don't want you guys to forget that. When you're thinking of bone, don't forget about what's happening with your gut. These are easy things to forget because it doesn't necessarily translate, bone and gut, but there's a very huge connection there. So ways to help your gut. Most of you who've been joining us for these doc talks have seen these slides before about flora. So this is one of our very favorite flora lines that we use, this human version of this probiotic. So it's a human strain specific to us rather than a plant strain or an animal strain other than human. So we find it to be very effective for going in and doing those jobs that our flora is supposed to be doing, like creating that K2. There are 2 main subgroups of these different bacteria that we're often looking at when we're looking at stool panels and things like that. We've got our lactobacillus and our bifidobacterium, and those are some of the best researched forms of these probiotics. Many of you have heard of prebiotics. Remember, that's food for the probiotics. So without that, our healthy flora cannot stay alive. We really want to remember that so much of this flora is not just affecting our nutrient balance, but it's also directly impacting our immune system. And remember, when we talked about inflammation before, if our immune system is out of balance, our inflammation is going to be out of balance in the body. So you can see how important the gut becomes here for bones. So about 70% of our entire immune system's regulation is tied up in the gut-associated lymphatic tissues in your digestive tract, which is pretty phenomenal. We also know that in order to keep and maintain our probiotics as we pass them through in our stool, we have to continue to either eat or supplement with them. So we want to make sure that those good ferments are part of our diet. Remember, they don't always have to be dairy-based ferments, although dairy-based ferments can be wonderful if you tolerate dairy in regards to bone density concerns. We have things like kefir and live activated yogurt as great options. And there are so many of those commercially available now. You don't always have to be making your own, although if you are, big pat on the back and thumbs up. As far as non-dairy options, we have things like our sauerkrauts, our other fermented cabbages, like our chip kimchi, are fermented soy products like tempeh and miso. And then there's also kombucha, which is going to provide those ferments as well for us, some different forms of those. So these are all great versions of probiotics. And just a reminder, this should be coming in on the daily. And if it's not in a fermented form like that, we are highly recommending to our patients to be supplementing with some form of probiotic supplement. Now, as far as the prebiotics, which I mentioned before, these are often thought of as just, the food that's coming in for our probiotics. And these are specific fiber types that our good flora loves to eat. And I love to think about this as the allium or the onion and garlic family. And so much of that is just can really be helpful prebiotics for fueling those good probiotics. Now, some people can't always tolerate these prebiotics. And if you find that you're looking down this list and saying, I can't tolerate these, then that's another sign for us that we need to do some more investigation and some more workup so that we can figure out what's going on with your flora balance that's causing you to not be able to tolerate your prebiotics. And most often that involves in an intestinal bacterial overgrowth that's inappropriate. So when our good guys overpopulate certain areas of the gut where they're not supposed to be, like up in the small intestines. So remember, it's important to be thinking about your digestion. Doing something like a stool panel, if you're concerned about your gut flora and your intestinal health, can be fabulous. To me, it's like looking inside of Pandora's box. We absolutely love the information that we're able to gather from simple stool testing, and especially stool testing now where we're looking at the DNA analysis with PCR analysis of our stool to figure out who's there. Do we have the helping microbes that we need? Are they at the proper level? Who else is showing up? Are they people or not people? Are they microbes that we've invited to our intestinal health flora party, or are they attendees that we don't want there? So this is really helpful information for us. So if it's something that you think might be impacting your bone health, definitely reach out. This is something that we work with quite a bit. I'll go ahead and pass this on to you, Dr. Mary.
All right. So goal number 5 is balancing hormones. So remember, estrogen is a major player when it comes to prevention of osteoporosis. And so we use some sort of estrogenic substance, whether it's herbal, bioidentical hormones, or conventional hormones, when we're trying to make sure that there's an adequate estrogenic effect present in someone's system to protect their bones. And so this can be useful when someone just naturally has low estrogen production, if they go through early menopause, and for postmenopausal women. So we can go on to the next slide. So phytoestrogens are estrogen mimicking constituents that are found in plants. And they're estrogen-like molecules that bind to estrogen receptors, and they provide an estrogenic effect that's not quite as strong as the estrogen that we produce in our body. And they're excellent for providing a consistent low level of estrogen, which, when it comes to osteoporosis prevention, that's really our goal, as opposed to with other effects, with other postmenopausal or with other menopausal symptoms that sometimes require a little more estrogen to address. When it comes to preventing osteoporosis, it's a low, steady amount of estrogen that we need. So the phytoestrogens contain lignans and isoflavonoids. Genistein is one that's found in soy and a number of the phytoestrogens that we use often, and it promotes weight loss and bone density. And interestingly, it's converted by intestinal flora to estrogenic compounds. So not everyone will respond to phytoestrogens in the same way. And as Dr. Molly was addressing earlier, this is just another reason why our gut health, the health of our microbiome is important in our bone health. Phytoestrogens have been shown to modulate hot flashes, to increase the maturation of vaginal cells, so that estrogenic effect on vaginal tissue. And in observational studies, they've been shown to inhibit osteoporosis. So some of the sources of phytoestrogens can be herbal, and we can also find them in food. So soy is an excellent source, and they have, through observational studies, we've seen that women in populations in countries where soy is a popular food product tend to have lower rates of osteoporosis. We also see phytoestrogens in flax, fennel, celery, parsley, nuts, whole grains, apples, alfalfa, and red clover. And we also have a wide variety of herbal phytoestrogens, including dungay, white peony, licorice, and many more. So super interesting and fun, engaging form of food and herbal medicine for preventing osteoporosis.
One of our very favorite and most used versions of a mineral containing supplement that also has a nice amount of genistein, that isoflavonoid that Dr. Mary was just discussing, in it is called Osteoben. And this is a product that we stock here at Prosper. And what it allows us to do is make sure that our patients are getting these highly available versions of these minerals, and at the same time getting a healthy dose of this phytoestrogen. And it's also an antioxidant in a non-soy form. It's actually derived from an herb. And we've seen in the medical literature, there's been some tests that have been run on this specific product, which I think is really cool, where they've taken groups of women and followed their Dexas. And I've certainly seen similar positive effects for my patients after watching them for multiple years on this product, seeing an improvement of bone density, which is really neat. So not only do we have the building blocks, but we also have this phytoestrogen version of a supportive for the hormonal balance. The other piece here in regards to this hormonal balance that we end up using quite a bit at Prosper is bioidentical hormones. And there's hormonal testing that goes along with that we're doing, because we want to really make sure that we're staying in that physiologic safe zone for our patients. And for those of you who haven't seen our talk on hormone regulation, you can go onto our website and check that out. We've got an archive there at prospernaturalhealth.com of all of our prior doc talks from this last year. And we talk about that quite a bit. But what's so important as a takeaway is that estrogen is very potent in regards to its effects on our osteoblasts, on those building cells of the bone. So we can be very serious as far as intervention that's still natural for our patients who have significant risk of bone loss, or for whatever reason have continued risk factors that are unavoidable in regards to bone loss. So it's been quite a pleasure to be able to work, especially with women, but also with men who need hormonal support to keep their bones healthy, and watching their bones remodel and become denser once those hormonal balances are addressed. Can be a pretty phenomenal thing to watch. So
now that we've sort of gotten the naturopathic overview, we'll sort of finish up the doc talk here with an Eastern medical perspective, both from the Ayurvedic medical philosophy, but also the traditional Chinese medical philosophy that Dr. Mary also practices. And so from an Ayurvedic perspective, Ayurveda in its Sanskrit meaning just means the science of life. Essentially, it's the traditional medicine from India. And when we think about osteoporosis, the root cause is low life force, low life essence, a Sanskrit term known as ojas. It's sort of, you eat food and it goes into 7 different tissue layers and you come out with, a drop of this life essence. That's sort of the visual that we can paint. So low ojas has to do with a low digestive fire in all of the 7 tissue layers. These dhatus is what they're called. And one of the last tissue layers, the 5th layer, is your bone layer. And we can tell the health of that tissue layer by looking at the teeth, the hair, and the nails. And from there, we can assess how well that tissue layer is actually functioning. And so a couple of traditional medicines are used for osteoporosis. The first one is a food, sesame. It's a high calcium food, and it's something we sprinkle onto rice dishes or just eat by the spoonful. And the second one is something known as shilajit, which you might have seen before. It's kind of a soupy, syrupy black product, and you take a tiny spoonful every day. And it comes from rock. Basically, it's a rock exudate. So you can imagine it's very high in minerals, the ones that are needed to build our internal rocks, which are our bones. And the Ayurvedic diet that supports or prevents osteoporosis is one that has nourishing tonics, a concept known as rasayana. So we've got to build all of the tissue layers before that 5th tissue layer, which is the bones. And so one of my general recommendations, we'll start with Tulsi tea to build that first layer, and hopefully it goes downstream fairly well. In general, we want to diminish what is known as vata, or air and space, right? When our bones are osteoporotic, they've got air and space in them. So to diminish vata, we want warm, soupy, well-spiced meals with nut milks. We want to sort of support from the topical perspective with an oil massage to the body, and naturally diminishing our cortisol levels with yoga and meditation. I'll hand it off to Dr. Mary for the traditional Chinese perspective here.
Dr. Rosalie, before we go further, would you explain to our listeners today what Tulsi tea is? And will you also just quickly mention why cortisol management is important in regards to inflammation and all that?
Sure. So Tulsi is one of the plants in the mint family. It's something you can grow on your doorstep if you'd like. And it's one of our adaptogens, is the herbal term for it, which means that you're able to better adapt to transitions, be it physical transitions or mental transitions, going from a rested state to a stressful one. Adaptogens sort of help even out that roller coaster. And then in terms of diminishing cortisol as a helper for preventing osteoporosis, that has to do with the fact that stress will increase metabolism essentially, and that cortisol will sort of dig away at the bones over time, especially high stress. Not to mention it's also inflammatory, and we'd already touched prior about one of the goals being an anti-inflammatory goal.
Thank you.
All right, so now I'm going to talk a little bit about the side of my practice that's traditional Chinese medicine and how it relates to osteoporosis. So traditional Chinese medicine is a practice that practitioners have been building for thousands of years, and it's based on what we call 5-element theory, and it's all about, similar to Ayurveda, bringing the body into balance between those 5 elements. That's diagrammed on the right here. So in this practice, each of the 5 elements is associated with an organ. And when it comes to osteoporosis, the kidney organ is particularly important. You can go to the next slide here. So the kidney essence, as it's called in traditional Chinese medicine, is responsible for regulating bone development when we're young, and then sort of regulating the metabolism of bone over time. And the kidney essence naturally declines with age, and therefore our bone density naturally declines with age. And so the long-term treatment strategy in Chinese medicine is to tonify the kidneys through acupuncture, herbal medicine, and nutrition.
I just want to add that I think it's really interesting, ancient wisdom here, or long-term held wisdom, because as we think about calcium leaving the body, we see it from the Western perspective as it exiting through the urine, which is one of the reasons that we can use things like urine tests and to check bone breakdown. So it's just interesting that it's the kidney.
Absolutely. Yeah, so probably our main tool in traditional Chinese medicine is using herbal medicine. So when it comes to deciding whether or not we want to focus on acupuncture or herbs, it's usually a matter of whether or not we really need to tonify. And in the case of osteoporosis, the goal is to tonify the kidney organ and the water element. So we use phytoestrogenic immune modulating herbs. One of the most popular formulas is called Zhuo-Gui-Wan, and it's also known as the Restore the Left Kidney Pill. And in traditional Chinese medicine, it tonifies kidney yin, so the nourishing, cooling substance of the body that can often decline postmenopausally. And in Western scientific research, it's been shown to stimulate the growth of bone-specific stem cells in cell culture studies. Here we have some specific herbs that are used as add-ons to some of our major traditional formulas. One is called Yin Yang Huo. As its name implies, it's good as a aphrodisiac, sexual tonic, but also stimulates kidney yang. And studies have shown that it stimulates osteoblasts and inhibits osteoclasts. So remember before we were talking about how the osteoblasts are building bone and osteoclasts are breaking it down. Next, we have Duzhong, which is this herb on the bottom here, and it contains quercetin, which is an anti-inflammatory substance that we often use in Western medicine. And it has also been shown to reduce bone loss via the anti-inflammatory action, as Dr. Molly had mentioned before. All right, so that's it.
So we're going to invite you guys to come to our August Doc Talk, which is going to be about sleep. We're going to really get into what healthy sleep looks like and how to achieve it, and talk about some of the pitfalls that people often fall into and get you guys sleeping better. So please, when you see the registration link for that, make sure that you register. We have a minute or two here for hormone or for questions. If you guys have any come up, I think maybe it'd be good to just read quickly these questions, but we also just want to invite you guys to make an appointment if you have questions, and we are happy to help you get to the bottom of what's going on with your bone health, and we really look forward to the opportunity to working with you guys on these things. So Dr. Rosalie, do you want to read some of these Q&A questions?
Sure enough. Yeah, we've got a couple questions. I tried to respond in the chat there, but one of them was how much radiation is in the Dexa scans? And also sort of historical question, when did this recommendation come to be? So in sort of my research here, the FDA approved Dexa scans in 1988, didn't start recommending them until the 90s for women, but it's Dexa is actually an acronym for dual X-ray something. So it's a type of X-ray, and it's just a short sort of burst of the ionizing radiation that's less than a typical chest X-ray and comparable to sort of your background daily radiation dose of just being a human on this earth where there's a lot of sunshine. Another question was, how often do we recommend Dexa scans? And it's a very patient-specific question, essentially. If we've got a patient or an individual who has advanced osteoporosis or we're starting to see signs of osteopenia, we might recommend it more often. Insurance plans typically reimburse every 2 years, but that's by no means what I do with all my patients. It's usually a longer amount of time. It's useful to repeat these tests to see if the treatment protocol is working. And that's kind of exciting when we get those data points and they do come back nice and favorable. I see that often times with sort of hormone replacement therapies, but also the phytoestrogens and some of the supplements we were talking about. Just a simple treatment switch there, and we do see that come back on those Dexa scans. And then lastly, Nancy had a question about how to eat red clover, one of our phytoestrogen isoflavone containing herbs. And usually I think of making tea out of it, but I'm sure you could get creative as a wild crafter and make a type of sog or like a boiled, puree of sorts. Otherwise, supplements are the tried and true way of making sure we've got a standardized product.
And I'll just chime in and say in regards to Dexas, I'm often encouraging my patients to do one of two things. One, if they can afford it, try to get it done yearly when they're initiating treatment strategies to make sure they're on the right track. We want to know as soon as possible. Every year of bone loss puts us at greater risk of more bone loss in the future. So this is something like a snowball falling off of a cliff. We want to try to catch it as early as we can before the problem is so severe. And also, I like to really encourage that my patients go back to the same facility if possible. Having that test done on the same machine is important for us in regards to calculation. It's not the end of the world if that's not possible because you've moved cross country or something like that. But generally, if we can get standardized data points, it makes a huge difference for us as physicians. And then there was one other question I don't know if we got a chance to really address about liquid berry.
Oh,
And
that
I'm
was my
assuming.
question. Yeah, it
Oh,
says,
great.
I was reading it on the label online. It says eat with meals, and then it says take it a couple of hours after you take your supplements and medication. I thought it was best to take your supplements with the meal as they would be digested better. So I don't know to take it away from meals or with meals, or if it matters.
So that's an interesting one. I actually often give that one right before bed to people without food. There are some of my patients that have kidney stones, and I think the same is true for Dr. Mary and Dr. Rosalie, that we're encouraging those patients, because this is a citrate product, to take their liquid CalMag berry with food. So that helps potentially reduce the risk of further kidney stone production. But that's one, it's typically very well tolerated. It's actually a product that I use for my kiddos even. And most people could tolerate it with or without food. There are some medications you want to make sure you're avoiding with calcium. Like, for example, if you're on thyroid replacement medication, that's a big no-no to have calcium at the same time you're dosing your thyroid medication. Does that help?
Yes, thank you.
Okay, great. Well, I think that we've covered the questions, and thank you to those of you who've stayed extra just a little bit here. And remember, we're available if you guys have any other specific questions, and we just so appreciate you sharing your time with us today. And we look forward to seeing you in August.